An increase in violence and poverty due to COVID-19 has affected the mental health of over 55% of young South Africans. That's according to a UNICEF South Africa U-Report released earlier this week. It found many are reluctant to ask for help, with 64% saying they didn't seek any assistance. UNICEF South Africa's Mayke Huijbregts joins us now to discuss the survey. Thank you very much, Mayke, for your time this afternoon. Can you give us the highlights of the findings of this survey?
Yes, thank you very much, Anli, for creating the opportunity to speak about the findings of your report. So this is a young people's report that we have created with over 100,000 young people in South Africa to hear the issues that they are concerned about. And indeed, up to 55% complained about high levels of anxiety. And these issues derive from loss of livelihood, high youth unemployment, uninterrupted learning journey, but also high levels of violence in the homes, as we have observed recently, and intensified levels of hunger. So these are the findings we are seeing. The impact thereof is through that children then demonstrate this through anxiety, bedwetting, insomnia, higher drug abuse, but some also have had up to 10% intentions to commit suicide.
Mayke, when we look at that significant number, 64% of those who took part in the survey saying they didn't seek any assistance, they were reluctant to reach out for help. What does that tell us about how we're trying to help young people during this pandemic?
So, Anli, it is, when people feel vulnerable, it's not an easy thing, right, to reach out to others and to talk about your vulnerability. So what we fortunately saw is that up to 70% of the young people talked to one another and sought peer support. This is incredibly important. But when you see more serious symptoms like intensified drug abuse, not sleeping and depression, it's important to seek official help. And official help, you can, through the GovChat platform, you can look for services. Through Childline, you can get official counseling. So it is important to engage with child and youth care workers, learning support agents at school, social service professionals through the various helplines that exist. But also identify a trusted mentor, either a parent or an older sibling, and otherwise an other older trusted caregiver in your near environment.
Amidst the COVID-19 pandemic and amidst that huge loss of income affecting not only young people, but in the cases of young people dependent on the parents as well, there might not be that home support. You say there are structures available like Childline, those structures obviously trying to do their best to reach out to the vast numbers of people who need their help. Do you think we have a drastically inadequate system of mental health support in South Africa that needs urgent address?
So, Anli, it is important to recognize the services that are there and they can be used, the Childline, as I said, and other social service professionals. However, for more the clinical mental health issues, there is still a shortage of professionals, not only in South Africa, but on the continent. And I think it will be important to really educate more clinical psychologists to address these issues of clinical psychology. However, in the meantime, it is important for young people, to stay fit, to keep a healthy diet, to keep socializing and stay positive, because they are the only ones that can create change in the pathway to their own future. And parents, caregivers, other members in society can help. As a state, there is, of course, opportunity and obligation to provide the services in education, empowerment, employment. We are working with the Presidency in support of the implementation of the President's Youth Employment Initiative. And we are staging the largest global platform on Generation Unlimited with the public and the private sector to make sure that we are building skills of young people and match them with jobs, mentorship, job shadowing opportunities with the corporate sector.
So part of the function of a report like this is to identify the problem areas, but those problem areas are very useful in helping us identify identify action points so that we can work towards solutions. What would you say are key action points that ordinary South Africans can implement to assist and support the youth in South Africa who are struggling with violence, with anxiety, with poverty, with unemployment?
It's very important to get off the devices and talk to one another. It's important, this quality dialogue and interaction, and to have a talk as a family about how people are faring. This is a very challenging time for everybody in the world, and it's important to take care of one another, to be social with your peers and so on, to allow for quality interaction, and to really explore opportunities in order. Everyone has to now take care and go out the extra mile to look for young people, to support them, start up grants, create initiatives where they can do mentorship, build a garden in the community, a water tank, but make sure that the education and youth employment initiatives really take off the ground so that they can see a pathway to the future. And that if there are serious issues of mental health, that there is an adequate referral system, starting with Childline and from there more to additional support if necessary.